This week's injury update is brought to you by the Jacksonville Orthopedic Institute. JOI is the official sports medicine provider of the Jacksonville Jaguars.
And we're visiting with Dr. Carl Freeman again here on Brent and Friends on ESPN 690. Specializes in the hip area, but he knows a lot more about than just the hip. And speaking of, Aaron and his Mets told us about an injury with David Peterson, I think, a pitcher, labrum injury around the hip. And it got me thinking, Doc, first of all, how are you?
I'm doing great. Thanks for having me.
Hey, good to be with you here on a Wednesday afternoon. We hear labrum around the hip, which is interesting because when I hear labrum, my mind goes to the shoulder because that's, I feel like, more common, at least in the sports that we cover. So I wanted to ask you, is there a difference between the two? Is one significant or more significant from a recovery standpoint, or do they both kind of respond the same way from when you injure the labrum in the shoulder or in the hip?
Well, let's start by talking about the anatomy of the shoulder and the hip real quick. So the shoulder is a shallow socket, and around that shallow socket, it has a labrum, a rubbery cartilage lip that acts to deepen that socket and kind of center that ball into the center of the socket, so that way when the musculature around your shoulder, like your deltoid and your pec and those kind of things, fire to move your arm around in space, that bumper is kind of allowing that ball to kind of ride up against it and center it back down into the middle of the socket. So it's really much more mechanical in the shoulder than the hip labrum. Now, the hip labrum, again, rubbery cartilage lip around the socket, but the socket is very deep. It's a true ball and socket joint, that hip is. And that labrum acts to pressurize the joint fluid to help create basically a perfect frictionless environment, but it also helps to provide a proprioceptive feedback. That's a fancy word to say that lets you know when you're reached the end of your range of motion through its nerve supply. And they both are very, very painful when they're torn because they're very well innervated. So both the shoulder and the hip labrum, very painful. And they both are treated with non-surgical treatment right away. So you rest it, ice, anti-inflammatories, those type of things, physical therapy, work the musculature around the joint, that type of thing is our first-line treatment.
That's pretty interesting. Recovery, we're using a pitcher example here, so that's baseball, but recovery-wise, is that a long process?
Well, I mean, if they protect that hip and he doesn't have too much deformity of the hip, then there's a good chance he can get by with non-surgical treatment. The problem with the hip labrum is that a lot of times the labral tear is associated with a deformity of that hip known as hip impingement or femoral acetabular impingement. And this is the thing that a lot of the hockey players are going out for treatment for this. A lot of soccer players get this. Many football players have it. About 30% of male athletes have some amount of hip deformity, and it's this deformity that bangs up against that labrum, tearing that labrum, causing the labral tear with flexion of the hip, forcible flexion of the hip.
That's pretty interesting as we visit with Dr. Carl Freeman from JOI, Jacksonville Orthopedic Institute, on Brent and Friends on ESPN 690. When we think hip, again, I kind of just totally putting in a box here, but I feel like it's like an older person injury. But obviously sports, it's a vital part of almost every action in sports.
Yeah, well, I mean, older people have hip conditions too. That's mostly arthritis of the hip. But younger athletes, this is kind of a new and burgeoning field in orthopedics that we're finding that a lot of those people that originally we had kind of written off that, he has a groin strain or something like that, turns out that they actually have more important conditions. And people have gotten hip injuries for a long time, but these used to be career-ending, but nowadays we have a really great way of treating them.
Dr. Carl Freeman with us here at ESPN 690. You studied from the bio I read in Switzerland. And how was that, by the way? That sounds like it would be a pretty cool experience.
Well, it was incredible. It was at the Swiss Olympic Medical Center called the Schultes Clinic, and it was a really neat place to study. Basically, early on in my career, the way to learn about the most advanced cutting-edge hip practices, because there weren't really fellowships and programs to learn about it around the country, is you had to go to where the experts are, and that's kind of like that was the focal point. That's where they were learning about this and kind of doing the most advanced cutting-edge surgery and research on this stuff. So the only way to learn about it was to go there.
You can read more about Dr. Carl Freeman's interesting background on joionline.net, Jacksonville Orthopedic Institute. And, of course, you can find him in the San Marco location as well. And so from your studies, or when you were studying to even now, over a decade ago, how much advance has been made in that hip area in terms of what you guys are finding and seeing and treating?
It's been amazing, both from the diagnostic side all the way to the surgical side. It's been a real evolution and really a revolution in care for the hips. Whereas before we used to tell people, take pain medications and use a cane if you're having early degeneration, early injuries of the hip. Nowadays we have some really good tools to address these underlying deformities that affect a lot of young adults with hip pain. And hip pain is kind of in the deep hip groin area. And a lot of these things, originally we had written them off as being something else like a groin strain or kind of pain in the lower abdomen. But it turns out hip groin pain, kind of that area where our body folds and a gene pocket sits, is where hip pain is. And so I see numerous athletes with this, and we're able to get them back on the field.
We cover the Jags so much around here, and we have a question here with you on about some of the injuries. And I know you probably can't get specifics and no specifics, but this is more general and broad. The question says, could the hamstring injuries be a training thing or a strength training issue? Because the Jags have multiple hamstring injuries right now, at least on their injury report. He said it reminds him of 2016-17 when he had so many core muscle injuries. And there have been pockets in my 15 years here where the Jags have had a bunch of core muscle injuries on their team or soft tissue injuries for a bit. So much so that I believe at one time, might have even been a decade ago, I think Jack Del Rio might have still been here, where they actually did testing on the field and other things. When you do see, just overall, if you were talking about a high school team or any team, do you see common thread injuries in your line of work where it could be about how athletes are training, or even the surface or whatever else they're training on or with?
It's funny because I want to say we were talking about it maybe 2 weeks ago about all these hamstring injuries that are going around all over the NFL. It's been almost a little bit crazy this season how many people are out on a hamstring related thing. And I was just reading about Tyreek Hill down in the Dolphins. I mean, there's a lot of these hip and kind of, the core muscle is above the hip. It kind of is around where our abdominal muscles attached to the pelvis, and then the hamstrings kind of behind the hip, where our hamstrings attached to our sits bone, the ischium. And what's going on around the NFL? Why so many players are having hamstring injuries? It's confusing. Surely they're not doing explosive running and forceful lunges any differently than they were a few years ago, but it does seem like there's more of them, and it's a little bit puzzling. I don't think that you could find a common thread, because these guys are doing the most cutting edge stuff in terms of strength training and practicing of anyone, so I'm a little boggled myself.
Yeah, it's interesting. Good question we had in there. And yeah, I think it's hard to identify. If everybody knew, right, they'd stop it.
Exactly.
That's part of it. And I always go back to, gosh, it's especially with the hamstrings and things like that, just fine-tuned athletes. I don't know what the hardest part about being a doctor is. I'm sure there are a lot of hard things as you're making your way up, but some of the definitions on some of the words that you just said to us over the last 5 or 6 minutes, that's got to be one of the most difficult parts. Please don't ask us to spell any of those words.
It's like learning a new language. Sorry if I use too much jargon. I apologize.
I kind of like it. I'm trying to, in my mind, figure out how I would spell it. Dr. Carl Freeman, thanks for visiting with us. Brent and Friends on ESPN 690. Have a great afternoon.
Thank you for having me.
That is Dr. Carl Freeman talking hips, talking a little bit of hamstrings. JOIonline.net to see more about all the doctors on the staff at JOI, Jacksonville Orthopedic Institute.